Hello and warm welcome to MedSynapse podcast series, where we bring you insightful conversation with leading experts in medical field. Hi, I'm your host, Dr. Smarika Bhatt, and today we are tackling into both fascinating and unsettling topic: is genetic research failing rare disease patients? Join us to know more. Today, we have extraordinary guest with us who is the forefront of this conversation, Dr. Debashis Bhattacharya. With a career span over 2 decades across continents, he brings a unique blend of clinical expertise, entrepreneurship, and a relentless drive to improve healthcare deliveries, particularly for those at the extremes of age. Welcome, Dr. Debashis, to the podcast.
Hi, Smarika. Thank you very much for this very, very nice introduction. I'm truly grateful for you. And first thing is, thank you for having me on the show. And most importantly, thank you for giving rare disease a space, which is so important in this day and age.
Let's start with the first question to have a conversation regarding the rare disease topic. CRISPR and gene editing technologies, they have been hailed as revolutionary, but are they living up to the hype? And what breakthrough do you foresee, and how close are we taking these therapies accessible to everyone?
Thank you very much for this question. The first thing, a little bit I want to say about rare disease. Rare disease is actually not so rare because the total global population affected is more than 300 million people. And India alone, it is supposed to be more than 70 million. Now, it is a bit of a diagnostic challenge because 50% of rare diseases remain undiagnosed or misdiagnosed for years. 80% of diseases have a genetic origin, and children and rare diseases are a very important component because 50% of the rare diseases actually affect children. And less than 5% of rare diseases actually have a FDA-approved treatment. So in this space, CRISPR and its related Cas proteins offer a modern form of curative gene therapy for treating the rare disease. Now, CRISPR, the full form of which is clustered regularly interspaced short palindromic repeats. Actually, what does palindromic mean? A palindromic means it is a word, a sentence, verse, or even a number which can read the same backwards and forwards. Now, CRISPR and other gene editing technologies have indeed revolutionized care, rare disease research, offering the potential to correct genetic mutations at their source. One thing about CRISPR is that it is precision editing and base editing which sets it apart. The advances in the CRISPR-Cas system, such as base editing and prime editing, allow for more precise corrections without causing double-strand breaks in the DNA, which is a problem sometimes. This reduces the risk of unintended mutations and it actually improves safety. Then our improved delivery methods, such as lipid nanoparticles and viral vectors, are enabling targeted delivery of CRISPR components to specific tissues, because this is very critical in treating diseases that affect very hard to reach organs. Now, some non-viral delivery systems are also being developed. Now, with the success essentially of drugs like Casgevy, which is developed by Vertex Pharmaceuticals and CRISPR Therapeutics, it is very groundbreaking because it has gone and treated things like beta thalassemia, sickle cell disease, and also we have Lyfgenia, which is a new drug which has been approved by as late as December 2023. It is a cell-based gene therapy for sickle cell disease in patients aged 12 and older. These approvals represent significant milestones in the application of CRISPR technology for treating rare genetic disorders. But having said that, with advancement of medical technology and drugs, these actually don't come very cheap. These gene therapies are extremely expensive, which is probably out of the reach of low and middle income group countries. They actually cost in millions of dollars. But anyway, with a lot of hard work, I think we are actually getting somewhere, because now with the increased adoption of generated drugs, then in the short term, what I see is there'll be more CRISPR-based therapies for rare diseases, particularly those affecting the blood, liver, eyes, However, these will remain expensive and accessible primarily in high income companies. But in the medium term, that is 5 to 10 years, there'll be advances in delivery systems, and manufacturing could reduce costs and expand access to more tissues and diseases. So on one hand, we have a lot of advancement with CRISPR gene editing, but on the other hand, it is actually not very friendly to budgets around the world. So we'll have to have a system by which we work towards it so that the price of therapy actually comes down.
Thank you, Dr. Debashis, for a wonderful description. As you have touched upon the drug prices and we speak of affordability, let's talk about the repurposing existing drug for rare disease. It sounds like a win-win in faster, cheaper treatment we are getting, but it is really that simple.
Yeah, I think repurposing is one of my very favorite topics, because at the moment, the research that I am involved in is actually, with something to do with repurposing drugs. Now, the thing is, most drugs, most diseases, they lack approved treatments. But drug repurposing, also known as drug repositioning, offers a viable solution by identifying new uses for existing drugs. Since these drugs have already been tested for safety, the transition into rare disease treatment can be significantly accelerated, reducing development costs and regulatory hurdles. Like, for example, I'll give you an example like Ambroxol. Ambroxol is a drug that we're working with. It's originally a mucolytic, but then it has been shown to be helpful in lysosomal storage disorders like Gaucher's disease, Fabry's disease. So we are working with these drugs. And most important thing is the safety data for these drugs are already present. So this kind of shortens clinical trial timelines, lower R&D costs compared to de novo drug development. You must realize that each drug which is developed actually costs in billions of dollars, out of which about 10 drugs come into the clinical trial scenario. Only one drug may or may not make it. So this is a big problem for pharmaceutical companies and also governments to invest in such a big, the investment is huge. So, but then this known pharmacological properties reduce the risk of failures, since we already know these drugs. So the risk of failure is much less. I mean, I'm not saying that all of them are going to be successful. Probably the drugs that we are taking through trials may not be successful, but then the cost to the sponsor is much less. Another thing is faster regulatory approvals bring hope to patients sooner. But the big problem here is many off-patent drugs, like for example, the drugs that we are working with, Ambroxol, metformin, L-citrulline, salbutamol, they lack financial incentives for pharma companies. So that is why I think we need a lot of governmental involvement, a lot of private equity involvement, because you don't expect to make too much of money with these. But having said that, the known safety and pharmacokinetic profiles of existing drugs, they reduce the risk of failure in clinical trials. So this is one of the way forward, I think, for repurposing drugs.
Dr. Debashis, one of the most heartbreaking aspects of rare diseases, Diagnostic Odyssey. Patient waiting years, even decades for the answers. So how is precision medicine changing this?
Yeah, the big problem with rare disease, essentially, I mean, if you take even global statistics, it takes about 5 to 7 years for a rare disease to be correctly diagnosed. Patients see an average of 7 to 8 different specialists before getting an answer. And the big problem is because of lack of awareness amongst physicians, the misdiagnoses are common, leading to incorrect treatment and worsening conditions. On average, rare disease patients consult multiple specialists before receiving an accurate diagnosis, leading to delayed treatment, disease progression, and a lot of emotional and, most important, a lot of financial distress for both patients and families. The reason probably is because people know very little about rare disease. There's very limited awareness, there are overlapping symptoms, and also lack of diagnostic tools, which conventional tests may fail to unearth any kind of genetic or metabolic disorder. So precision medicine in its current form is probably a game changer. It tailors diagnosis and treatment based on the individual's genetic, molecular and environmental profile. It, instead of relying only on symptoms and trial and error treatments, clinicians can now leverage cutting edge technologies to pinpoint the exact cause of a disease faster and more accurately. For example, genetic and genomic testing, advances in whole genomic sequencing, whole exome sequencing, and RNA sequencing allow for rapid identification of disease-causing mutations. This has been particularly impactful in neuromuscular disorders, metabolic diseases, and some very rare pediatric syndromes. Now, AI and machine learning, AI-driven algorithms, which is actually revolutionizing the whole world. Now we're only talking about AI and machine learnings. Now this is tremendous use in the rare disease spaces because it can analyze vast amounts of medical data, imaging, and genetic information to actually flag potential rare diseases. Now these tools help reduce diagnostic errors and accelerate referrals to specialists. The future, to end this odyssey, what we need, number one, is increased awareness and training of physicians on rare diseases, better insurance coverage and affordability for genetic tests, because these tests don't come cheap. They are still very, very expensive. And if we can have some global data sharing initiatives for faster identification of ultra rare conditions, which even with your precision medicine can be very difficult to diagnose sometimes. And there should be stronger collaboration between healthcare provider, biotech company, and patient advocacy groups. One thing I have to say here that, at least in India, the government finally has woken up and is taking a very big initiative. We are actually driving towards better patient care in rare diseases, which probably I'll talk later on. Yeah, go on.
So after you describing in detail about the rare disease and its impacts, which brings me to my next question is, rare disease research is often concentrated in high income countries. So how do you ensure that low income or middle income countries aren't left behind?
I think this is a very nice question, because we live in a very middle or a low income country, and it is very, very relevant to us. I think the first thing that we should do is we should strengthen our healthcare infrastructure. The first thing is we should build advocacy and awareness amongst doctors, because in medical school, as you probably know, we do not actually read too much about rare diseases, and then we branch off into our own specialties, and rare disease is something which is very overlooked. It's only later on in life when we encounter this, that is the time we realize that. So I think we should build a lot of advocacy and awareness, and we should do an extensive capacity building exercise in training healthcare professionals in low and middle income companies to recognize, diagnose, and manage rare disease through workshops, online courses, and partnerships with international experts in this field. Actually, the Helen Wings Foundation, which I am kind of heading in the medical bit, we have taken a big initiative. We are working with the central government. We are working with the governments of Tamil Nadu. We are working with the governments of Karnataka to actually start somewhere. Because honestly, there are 70 million patients with rare disease supposedly in India, but only about 2,500 patients are actually getting the benefit. So there's a huge gap. There's somewhere, where are all these patients going? And the second thing is to build a patient register. I mean, these are things that we need to do. We need to get together. We need to identify patients. Like, when we speak to, let us say, pharmaceutical companies, about, these drugs, how to reduce the prices of these drugs, they say, we don't want more patients because the thing is, who is going to pay for these drugs? So another thing is diagnostic tools. We should provide access to essential diagnosis tools like genetic testing, imaging technologies. We need to work with genetic testing in, I would probably say, in the rural place. And in the number of tests that you do, obviously the price is going to come in. And Also, we should actually increase telemedicine efforts, because telemedicine networks can connect local providers with maybe rare disease specialists globally, enabling remote consultation and second opinions. Second thing is, we should start a public awareness campaign, because public awareness, unless the public is aware, otherwise, these in India, especially patients in the villages, a lot of them, they suffer and they don't even know that this needs the referring to a doctor. And then, of course, we should ensure access to treatment. Drug repurposing is a big field, especially because many of the pharmaceutical companies and the Western world is not interested in some basic research. So our country should take the initiative. There should be a lot of governmental investment. Like, for example, in India, that this is what is coming in 2025. We have got the ICMR, the Government of India, the All India Institute of Medical Sciences to actually invest in these clinical trials, because if these drugs actually can pass these clinical trials, then the price of management of any rare disease is going to come down like anything, because it costs crores. Some of the enzyme replacement therapy, some of the substrate therapy, they are running crores. But the drugs that we are proposing, and that will be a very big change which is actually coming. And the final thing is financial support. We, from the Healing Foundation, that is something that we have actually undertaken from our side, that we want to provide financial assistance to patients. I mean, whenever we find these patients, we shall have to kind of get some kind of a private money, high net individuals, or from wherever, is to provide this financial support. But increased awareness, as soon as there are a lot of people being involved, obviously the costs are also going to come down. And finally is integration with primary providers. We have to teach them how to recognize early signs of rare disease and refer patients to specifics. And of course, the World Health Organization, we have to advocate for the inclusion of rare diseases in WHO initiatives and global health agenda. I mean, this is something that we could probably do this.
Okay, so we'll wrap up the podcast with one last question. Looking ahead to 2025, what are the top 3 breakthrough points you hope to see in rare disease research, and what it will take to achieve them?
Yeah, I think this is a very, very interesting question. 2025 is going to be a very watershed year in rare disease space, not only globally, but also in India. The first thing is AI-powered diagnostics. Okay, the average rare disease patient waits 5 to 7 years for an accurate diagnosis. AI and machine learning could cut this time drastically by recognizing patterns, using AI-driven symptom checkers, and predicting genetic mutations. Second thing is gene therapy 2.0, as we had already talked about CRISPR technologies. I mean, next generation gene editing, non-viral delivery methods, and more scalable manufacturing, because we want these drugs to come to the third world, if I may. I don't know whether it's still used or not. And third thing, which I'm very looking forward to, is drug repurposing at scale, faster and affordable treatment, because what it will take more incentives from pharma companies to invest in repurposing efforts, global orphan drug policies that support repurposed treatments, and public-private partnerships to fund large-scale AI-driven drug repurposing projects.
Dr. Debashis, thank you for sharing your insights. It's clear that while we have made strides, there is still much ahead work to be done in the future. And thank you to our viewers for tuning in. And remember, if you are a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate us to join on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay healthy, take care.